Welcome dear students to Dr. B.R. Ambedkar Open University. I'm Saeed Akbar. I'm going to talk about communication skills for healthcare managers. The topic I'm going to talk about today is listening. What does it mean and what are the methods? Let's start with a basic question. What do you think listening is about? Like most people, you probably might be thinking a good communicator is someone who can speak well. Speaking, however, is just part of the total process of communication. In order for speakers to get their message across, someone must also be listening. And listening, my dear friends, is not an easy task. Everyone does not know how to listen effectively. The most important communication skill is listening and is also the hardest skill to master. Effective listening involves more than just hearing or the reception of the sound through the ears. To be a good listener, you must also understand and interpret sound in a meaningful way. A good deal of thinking must go on in effective listening as well. When messages are misunderstood, it is easy to blame the speaker, but the listener must also share the responsibility. The average person misses about 75% of what he or she hears. Listening effectively takes skill, self-motivation, and practice. Effective listening means concentrating on what the speaker says rather than on how it is said. For an example, if somebody is speaking, if you get distracted or you are interested into something else, you might not get the message clearly from the speaker's speech. Many successful leaders and entrepreneurs credit their success to effective listening skills. Listening is the key to all effective communication. Without the ability to listen effectively, messages are easily misunderstood. Now, coming back to our basic question, what is listening? Listening is the process of receiving, constructing meaning, and responding to spoken or nonverbal messages. Listening is the ability to accurately receive and interpret the messages in the communication process between two or more people. Listening and hearing are not the same. Hearing is the first stage of listening. It is a physiological and involuntary process, as hearing occurs when your ears pick up sound waves which are then transported to your brain, which causes firing of electrochemical impulses. This stage is the sense of hearing in your body. Listening, on the other hand, is a psychological and voluntary process when compared to hearing. You have to pay close attention to and making sense of what we hear. It is a learned skill of understanding and interpreting what the speaker wants to say. Listening can be divided into two parts: understanding what has been said and remembering what has been said. When you take into consideration understanding, it is repeating the information with a question in your mind. Ask for the repetition of a specific information that was given to you, like, what did you say about so and so? Use the question in your answer as well. When you're talking about remembering, repeat what you have heard and say what else to clarify. Put pauses between the phrases you're asking questions for. Chunk into by the phrase the speaker had referred to. Repeat quietly to yourself. Repeat information in your own words so that the speaker understands that you have got his message and there is a small doubt about a particular term he has to elaborate. Make an association and meaningful or silly mnemonic sound when you're talking about the said words. Repeat what you have heard in the questioning voice to confirm. Picture the information in your head as well when the speaker tries to talk about it, and remember and talk to the speaker or ask the speaker questions about the same. Now, why do you think listening is important? Listening is important and essential for interactions between two or more persons, like a group. In healthcare organizations, listening is important for administrators and service providers. Effective listening in healthcare, especially for a physician and manager, is the prime area of concern. Many studies reveal that the physicians and managers are not good listeners. What happens and why do you think listening is important? With proper listening, you better understand. There's improved communication between two or more or a group of people. You are building trust between both the people or a group of people. There's conflict resolution when you listen properly what the other person or the speaker has to say. You avoid misunderstandings which are unnecessary and untoward or uncalled for. There are some facts about listening, my dear friends. We spend significantly more time in listening, that is about 45%, than talking, that is about 30%, and reading, that is about 16%. When compared to writing, it is the least, that is 9%. Physicians interrupt 69% of the patient interviews within 18 seconds of the patient beginning to speak. Most of the physicians don't empathize with their patient, don't listen to them properly, don't give them a response, whether it is a verbal or non-verbal, and end the talk from the patient's side and start their own prognosis or diagnosis. In 77% of the interviews, the patient's true reason for visiting was never elicited or explained or known. Healthcare practitioners who use patient-centered communication include listening, have patients who are more satisfied with their practitioners and their overall medical care. Patients tend to like the physicians and like the administrators who listen to them with their whole heart and with a calm mind. Let them complete at once about their disease, about their illness, about their suffering, and then listen to the speaker, that is the doctor, that the physician or the administrator counsel them. Effective listening is significant predictor for patient satisfaction. In healthcare settings, the largest indicators of patient satisfaction with physicians' communication skills are attentive behavior, empathy, and listening. The most important communication skill in the doctor-patient relationship is listening. Healthcare managers are required to listen up to 60% of their workday. They have to supervise their subordinates in certain way, listen to the complaints about the operations in the hospitals in day-to-day work. Most individuals at the work spend the majority of their communication time listening, but use only 25% of their innate ability to listen and understand the root cause of the problem. Let's go to the type of listenings. Listening can be categorized into two types, positive and negative. The positive listening means fully focusing to understand, empathize, and build connection using open body language, asking questions, and staying calm. While negative listening involves distractions, interrupting, judging, and formulating responses, or only hearing the facts, leading to misunderstandings and poor relationship between the speaker and the listener. Positive listening is about engagement and comprehension, whereas negative listening is often self-focused, leading to poor communication outcomes like confusion and conflicts. Let's talk more about positive listening. Positive listenings are of many types. Let's talk about a few. The first thing is about active listening. It is an intent to listening for meaning, in which the listener checks with the speaker to see that the statement has been correctly heard and understood and responds with verbal or non-verbal methods. The goal of active listening is to improve mutual understanding. Appreciative listening is when a person listens for pleasure or enjoyment or meeting his interests. The third type is discriminative listening. It is when a listener learns to distinguish the difference between sound structure. The fourth type of positive listening is deep listening. It is when you go beyond what is being said. In this scenario, the listener needs to have a contemplative mind. You have to go beyond your reality and foresee what the speaker wants to convey as a message to you. Fifth is empathetic listening. Listening to provide emotional support for a speaker. It is to understand the speaker's feeling, expressions, and you can see his or her point of view regardless of whether you share the same perspective or not. When listening to a complaint of an employee, the manager has to adopt this kind of listening style. That is where, when you empathize with your subordinate and understand what went wrong, what is to be done, and what has to be done in the near future. That is only achieved with positive and effective listening. The last one is sympathetic listening. It refers to the feelings of concern and responding in a way expected by others. The next part is critical listening. It is to evaluate the message for purposes of accepting or rejecting it. It is to evaluate and understand the meaning of and the strength of evidence and the speaker's intention and motives on several levels. The next part is reflective listening. It involves listening with an intention to give feedback to the speaker. It can be shown with the nodding of the head, with sounds like when you're listening to somebody, or yes or no, so that the speaker feels that the audience is connected to him and is listening to him properly and is responding to his words. The next part is emotional listening. When listening with emotions like fear, reverence, and hatred come into play. Here comes the personal factor or the personal touch. If the speaker is speaking and you don't like the speaker, you might have bad feelings or a hatred feeling for him and wish not to listen to him properly, missing the message what has to be said by the speaker, which is misunderstood by the listener. The last one is the therapeutic listening, refers to the treatment intended to relieve or heal or bring about a desired behavioral change in a listener. This could be whether it's an ijtema or whether it's a community meeting from different religious faiths. Now coming to the negative listening. The first type of negative listening is fake or pseudo listening. This occurs when a person is pretending to listen, but in reality, all that being said is only heard but not absorbed by the listener. He is not at all interested in listening to the speaker and has no idea what the speaker is talking about. The next type is spasmodic listening. It is a discontinuous process of listening. The listener pays attention to the speaker for some time and then shifts the attention to something that interests him. This is a perfect example of a classroom where students tend to listen to the lecturer or the professor when he talks or speaks about a particular topic, and after some time there is some disinterest among the students and they look here and there and they don't concentrate on the topic which is being told by the speaker. The next type of listening is inactive listening. Listening with a wandering mind. The listening is physically present and mentally absent, not able to listen to anything that results in waste of time of the speaker and the listener as well. This again goes an example for the classroom study that happens at colleges, schools, and universities. The next type of negative listening is biased listening. Happens when a person listens what they want to hear and misinterpret or distort what the speaker has said. Here is selective listening. Here the speaker says something and the listener listens to what appeases him or he likes from the part of the speech. This is called as biased listening. Then comes selective listening. It is a technique that filters, leads to listening what they want to listen. Choices are again influenced by their preferences, bias towards the subject or the speaker. Coming to the next topic of my session is barriers to effective communication. The barriers in effective communication in listening comes through the difference in language. If there's a foreign language involved or spoken by the speaker, the listener cannot understand because he does not know the basics of that particular language and what is being said or spoken during the lecture. Next is dysphonia. If the speaker is having a sore throat or the voice is not appeasing to the listener, the interest of the listener will go and the speaker's message will not be transferred or accurately understood by the listener. The next one is time constraint on the physician or the patient. Other aspects can be illness, mental state of the listener, medication effects, physiological or emotional state of the listener, then gender differences, race and culture, and the speech ability or the language articulation spoken by the speaker and what is heard by the listener. Some of the recognizing barriers to listening are noise or lack of interest from the listener. It can be distractions or unable to concentrate due to fear or other aspects. Imperfect past, present, and future tense spoken by the speaker. It can be related to stress or hypertension within a listener who cannot concentrate on the spoken words of the speaker. It could be a familiarity trap. It could be a topic that you have already listened to and it does not make any interest or bring in any interest to the listener to listen to your particular words spoken. It could be ego issues wherein a listener does not want to concentrate upon what is being said by the speaker because he might be a superior, he might be a subordinate, he might be someone who does not interest him in the particular topic. The next one could be close-mindedness or preconceived ideas and notions about the speaker. You might have your own idea that this speaker is not good or worthy enough to listen to, and that's the reason you show zero interest or no interest or little interest in the speaker's words and do not listen to what message is being communicated by the speaker. The last ones would be overemphasizing the source. You might be thinking that the speaker is of high regard or he might be a person who speaks all the things that are facts and you don't concentrate upon that for an instance. Listening only to what is easy to understand can be another factor or barrier to listening. Sometimes the speaker might have a vocabulary that you might not understand. The words that are being spoken by the speaker might be of a dictionary words and you might not be able to understand that particular words perfectly. Coming to the process of listening now. There are about 6 basic stages of listening process. The first part is the hearing. Second is attending. Third is understanding. Fourth being remembering. Fifth evaluating. And the sixth one responding. Let's elaborate it one by one. The stage 1 is receiving or hearing. It refers to the response caused by the sound wave stimulating the sensory receptors of the ear. It is a physical response by your body. Hearing is a perception of sound waves. You must hear to listen, but you need not listen to hear. So this is the first basic step of listening. The second step is attention. The brain screens the stimuli and permits only a few selected words that come into focus. This selective perception is known as attention that is given by a person for the speech. The third part is understanding. To understand symbols and meanings we have seen and heard, we can and we must analyze the meaning of the stimuli we have perceived. The fourth step is remembering what has been said by the speaker. It is important listening process because it means that an individual has not only received and interpreted a message but also added to it the mind's storage bank. Whatever the speaker has spoken, you correlate to those words and then remember what you have listened in past or what you can relate to that particular topic or terminology. Fifth step is evaluating what you have listened. It is a stage which active listeners participate in. It is at these points that the active listener weighs evidence, sorts facts from opinion, and determines the presence or absence of bias or prejudice in a message spoken by the speaker. Last stage is the responding stage. This stage requires the receiver to complete the process through verbal or non-verbal feedback because the speaker has no other way to determine if the message has been received by the listener or not. Non-verbal responses includes frowning, includes smile, clapping or standing ovations by the audience so that the speaker can understand the audience got his message or did not get his message properly. Verbal feedback is doing what the speaker asked or expected to do, like the speaker asking the audience to clap their hands, shout a particular word, or something else. Let's come to guidelines related to effective listening. To become an effective listener, you must increase your listening skills and employ right strategies like ability to pay attention, to process sounds into meanings, to evaluate and remember. An effective listener should make sure all the barriers to listening are removed. There are certain steps which you follow become an effective listener. First is there are certain steps if you follow you become an effective listener. First is maintaining eye contact. Second, being removing distractions to be attentive and relaxed. Third is keeping an open mind to what the speaker wants to say and convey. Fourth is avoiding interrupting or imposing solutions or presumptions. Fifth is to wait for pauses and ask clarifications if you have any questions. Sixth is asking questions to ensure understanding of the speaker's words. Seventh is giving regular feedback to the speaker. Eighth is noticing non-verbal cues and what is being unsaid. Prepare yourself to listen is the first step. Now, listening is a choice. In order to hear and understand everything a speaker has to say, you must be ready to listen from the beginning. This means arriving early, getting sufficient rest, or finding out much about the speaker's topic before you arrive. Clear your mind of distractions. Put away devices or pause other tasks which you intended to do. Be mentally ready to pay attention. Show that you are paying attention is the second step. Maintain comfortable eye contact with the speaker. Use open and relaxed body language. Nod occasionally to show that you are understanding what the speaker is saying. The third step is be fully present. Focus on the speaker, not on how you will respond. Avoid interrupting or finishing their sentences. Give them time to express their thoughts completely. The fourth step in the guidelines for effective listening is listen for meaning, not just words from the speaker. Pay attention to the tone which the speaker talks and the emotions and non-verbal cues as well. Identify the main ideas and key points. Notice what is said and what is left unsaid in the speaker's words. Fifth is asking questions for clarity if you have any doubts. Use open-ended questions when asking questions to the speaker. Can you explain me more about that? Can be an example. Confirm details if you are unsure, like do you mean this and this? The sixth step is reflecting and paraphrasing. Briefly restate what the speaker said in your own words, like, so you're saying that so and so happened, so and so is the particular problem, like. This shows understanding and gives them a chance to correct the misunderstandings during the session. Seventh is avoiding judging or jumping to conclusions. Keep an open mind, listen without criticizing or making assumptions, evaluate the message after hearing it fully. The next step is controlling your emotional reactions. Stay calm even if the topic is sensitive. Don't let personal biases interfere with listening. The next step is providing thoughtful feedback. After the speaker finishes, share your perspective respectfully. Relate your feedback to what they said, not to unrelated issues being spoken during the sessions. Remember and follow up. Take mental or written notes whenever appropriate during the session. Show that you valued the conversation by following up later if needed. At the conclusion, dear friends, I would say that listening is not just a communication skill in healthcare, it is a form of care that in itself provides truly hearing their patients, building trust, strengthening relationships, and creating foundation for accurate diagnosis and effective treatment in the healthcare industry. In an industry centered on healing, listening remains one of the most powerful tools we have. In healthcare, listening is more than courtesy. It is critical to quality and safety of the patients. Every story shared, every symptom described, and every concern voiced guides us towards better decisions and better outcomes in the hospitals. When we commit to listening, we commit to delivering care with that is respectful, responsive, and ultimately life-changing. At its core, healthcare is human care and listening is where it begins. When we listen well, we understand more and we connect more deeply and we treat more effectively. My dear friends, as healthcare professionals, my dear friends, as healthcare professionals, our greatest strength lies in not just in our clinical expertise, but in our ability to listen to patients, to families, and to each other. By valuing every voice, we create a culture of empathy, collaboration, and excellence. With this, my dear friend, I come to the end of our session. Thank you so much for listening. Take care.